Hi, everyone. We did our diversity awareness project on the Navajo Nation. Perfect. The Navajo tribe is one of the largest Native American reservations in the United States in terms of land and people. There are over 300,000 people who are enrolled in the Navajo tribe. However, just around 200,000 live in the reservation, which is this yellow area in the picture here. The reservation is around 25,000 square miles, with most of the land being in Arizona. In this picture, you can also see how the land spreads into New Mexico and Utah. We can switch slides. I'm going to be going over a brief history of the Navajo tribe. In 1863, the Navajo tribe went from roaming freely all over the Southwest to being attacked and forced into surrender by colonists. Their homeland was destroyed and burned down, along with all of their livestock. For the Navajo people that weren't murdered in this, they were forced to travel the Long Walk, which was a trail that was over 300 miles to a small reservation in New Mexico called Fort Sumner or Bosque Redondo. They were prisoners here and they couldn't live normally like they were used to, and a lot of them died from disease and starvation. A peace treaty in 1868 allowed the Navajo people to go back to their homeland, land that colonists had deemed useless, where they began to rebuild their community. Since they were able to return to their homeland, and since they were pretty separated from European Americans, the Navajo people were able to retain and strengthen their language and culture, which are both very strong to this day. We can switch slides. Perfect. A strong tradition among the Navajo people is the Hatali or shaman, which are medicine men that perform traditional healing ceremonies. They cure the mind, body, and spirit. These practices include singing, chanting, praying, sweat baths, and sand paintings, and they can use herbal medicine to heal the person and restore their harmony. These ceremonies can last anywhere from 1 to 9 days and often include family members of the patient. The medicine men are highly revered by the Navajo people, and they are seen as leaders. On the Navajo reservation, medical buildings must be built with separate traditional healing rooms for the Hatali. The Navajo people are very spiritual and have rich rituals and ceremonies. They are very connected to their families and love for their land. We can go to the next slide. There is an extreme power and privilege discrepancy with the Navajo people compared to the rest of the population of the United States. Not only is their history riddled with racism and colonization, but they currently have significantly lower incomes, lower home ownership, and significantly higher rates of poverty. Tension has been abundant between the Navajo people in the United States over land and livestock management and political issues. These issues usually end in the disruption to the Navajo people's politics, economics, and social lives. And you can switch to the next slide.
Based on Sarah's information, we know that the Navajo people lived on rugged lands with poor infrastructure. Isolation and remoteness present many challenges for the Navajo people, primarily because of economic instability, road conditions, and access to transportation for people who live on the reservation. This means they lack access to quality education and healthcare. Many Navajo people live in a food desert, which means they lack access to nutritious and wholesome food. Transportation is essential to healthcare. These social determinants are disproportionately affected on the Navajo people, and they have a higher disease burden. These are broad quality of life issues rooted in economic adversity and poor social conditions. So let's compare some numbers. Navajo people have a mortality rate that's 31% higher than the US average. The prevalence of disease on the reservation is also much higher. You can see here that the average Navajo person lives to 72 years, while as in the US, they live to 77 years. The disease prevalence is also worse. Diabetes affects about 1/4 of, or 1/2 of adults living on the Navajo Nation. And these people are diagnosed with either diabetes or pre-diabetes, compared to US, where there is only 1 in 10 adults who have diabetes. This can be explained by the scarcity of wholesome food and lack of grocery stores in these rural areas. When diabetes is left untreated, people can suffer from diabetic retinopathy. It's an eye condition that can cause vision loss and blindness. Navajo people also suffer from alcoholism at a higher rate. 1 in 4 people have had a problem with drinking compared to 1 in 18 people in the US. Their highest causes of death are from accidental injury, heart disease, cancer, and diabetes. As you can see from the last 2 slides, the social determinants of health highly affect the rate of death and disease on the reservation. All these health issues are exacerbated by the fact that many Navajo people lack access to healthcare. Health disparities reach beyond physical determinants and are often impacted by relationships between providers and patients. Without access to healthcare, quality education, and healthy foods, Navajo people on the reservation will continue to suffer worse health outcomes than mainstream Americans.
So it's pretty obvious that not every person acts or thinks the same way, and this statement relates well when it comes to healthcare and a provider-patient relationship. Some differences I listed above are education, culture, socioeconomic status, sensitivity level, and this is just to name a few. I will speak mostly about culture. Cultural differences lead to a conflict in patient-provider relationships. However, studies have uncovered that having commonalities among culture is the most competent form of healthcare. Not everyone has access to this luxury of clearly outlined cultural standards being understood by healthcare providers, which is kind of frustrating at times. Next slide. Just to name a few, I wanted to go over some do's and don'ts with the Navajo culture, what will best suit them, and some explanations behind it. The Navajo community thinks many topics related to healthcare is scary or negative. However, they are slowly being more exposed to this idea of negative information about health because they are in fact working with Western medicine practicing doctors, as Sarah shown before geographically, that's just where they sit. This is a problem for them. It has often hurt their relationships with their providers and has become something that traditionally offends them culturally. This isn't that doctors are doing anything wrong. In fact, they're being very honest, using skills to gather informed consent and planning for their patients' future interventions. That's basically what you would want your doctor to do. However, the caveat to this is that it's not being done in the best culturally sensitive way for the Navajo community. There are more things to be considered to create a more culturally sensitive approach. Some other do's and don'ts that I listed is to ask the patient if they're willing to engage with you about their health, kind of prepare them for that. Number 3 is to communicate with your patient that the message you share is indeed intended to not cause harm, mostly to help them. And the last among many is to create rapport with your patients, take time, and show that you care throughout the visit. There are several do's and don'ts that are not just specific to this topic, but listed here are just the main ones that I found in the literature. Next slide. I said that becoming more culturally sensitive would help you become a better care provider. And here's one example that I wanted to touch on. It is looked at as a very comforting feature to have others join the patient when it comes to sharing health-related information. Joining the patient could be family members such as siblings, parents, or grandparents. They can also be church group leaders or representatives from religious groups. Sarah mentioned shamans. For this culture, it is a form of comfort and guidance when religious members are present. Religious leaders or shamans can often prepare the patient for the appointments the day before by helping facilitate prayer or ceremonies, bringing peace to the heart and mind of the patient. Be okay with others being in the room when you're sharing information. These providers can also take the initiative to invite the patient's family members to come into the room. Next slide. I discuss a lot about culturally sensitive approaches. I wanted to touch on what we can do now to better prepare for a cultural group like the Navajos. So feel free to read through these points, but something that's different and something I wanted to bring up especially is the second to last point. The second to last point talks about how a direct approach is not the best way to share information with your Navajo community member. To better understand this, I will give you an example. It's best to ease into the diagnosis. To do so, some providers who are culturally aware will usually say things like, "This is probably what you have," to give the patient time to think about, digest, and understand what the steps might be moving forward based on the diagnosis. Next, a provider might say, "People normally do this after being diagnosed." Again, this is pretty different from a Western medicine approach, where we are more upfront, honest, with little empathy or sympathy. However, this is culture. These are brief reasons why learning and understanding culture makes anyone a better care provider. This is truly a people business, and if we do not cater to our audience, we will not have an audience. Ending our presentation is just a few of our reference points, but thank you for listening.